Welcome to our insightful moment for today. Today, we are going to look at the requirements for a doctor, a Kenyan Trained Doctor or an African Trained Doctor interested in working in UK. The steps that you're going to follow, and you're also going to look at the associated costs with each process. The first thing is that you should ensure that you are registered, that the university you are studying in is registered with the World Medical Directory. The World Medical Directory is a database of all the universities that are recognized by the GMC, and the GMC is a council that registers doctors in the UK. If you have already finished your university studies and you notice that your university is not recognized by the GMC, what you do is you go through the Students' Union, or you can appeal to the representatives of your university to ensure that they are registered. If you are already in session, meaning maybe you are third year, fourth year, or fifth year, and you notice your university is not recognized, start the process now, because you will not work with the UK if your university is not in the database of the World Medical Directory. If you have not joined university, kindly first check the World Medical Directory and check if the institution that you intend to study is registered. If it is not registered, don't study there. Choose an institution that is recognized. According to KMPDC, which is the body that regulates training of institutions in Kenya, we do have 13 universities which are allowed to train medical doctors in Kenya, 13 of them. But only 10 are recognized by the World Medical Directory. And I'm going to give you the list. Notice that things can change. I'm doing this video in July of 2025. August, September, some institutions will be joined and some may be dropped. So it is always good to confirm. But for information purposes, University of Nairobi, KU, JKUAT, Uzima University, Kisii University, Masinde Muliro, Egerton, Maseno, Moi, and Kemu are the 10 institutions in the World Medical Directory. I told you the other 13, so we have 3 that are not in that list. After you have ensured your university is in good standing with the GMC, the second step is to finish your internship. Yes, internship is very important. I know that thing is usually tricky, it's hard, it's disturbing, but your internship will have a lot of weight when it comes to requirements of the GMC to register you. The first thing they will want to know is, when you finish your internship, how much time did you spend in each rotation? So the recommendation letter that you will get, ensure that it reads you are in this period in internal medicine, this period in surgery, at least 3 months in surgery, at least 3 months in internal medicine. Do not accept to get a letter. Like, we had a case where a student did an internship, but they were given like a broad recommendation letter. It was not saying how much time each person spent in each rotation. When we took the letter to the GMC communicated again, and they said they need to know the amount of time that was spent in each rotation. So now it was to set up communication between the GMC and the council, and that takes a lot of time and it will drain you. So ensure that the recommendation letter that you get is specifying how much time was spent in each rotation. The other thing to notice is that the GMC requires that you sit for your internship within 1 year from the time that you graduated. Hello Africans, hello Kenyans. Sometimes our doctors take so long before they are tested for their internship. So long. So what you do as a wise person who have your end goal in mind, if you know you want to go and work in UK, immediately you finish your studies, even before graduating, attach yourself to an institution and gain clinical experience. Yes, the GMC considers pre-graduation experience. And then the referral letter they will give you, ensure they have specified the amount of time you spent in each rotation. Because they require that if you took more than 1 year from the time you graduated, the GMC requires that you do your internship for 24 months. That will be, making things harder for you. So be a wise person. Immediately after school, attach yourself to an institution, and preferably a big institution where you will get experience even in the surgery. And then ensure that they give you a letter and ask them to specify the time you spent in each rotation. Okay? After now you have finished your clinical internship, the next thing that you do is that you ensure that you have done your English test exam. Every doctor working in UK needs a document to show that they have good understanding of the English language, their speaking skills, their listening skills, their reading skills, and their writing skills. So there are two exams that you can sit for. There is the IELTS exams and there is the OET. So the IELTS exam, you will sit for the IELTS academic exam. It is a normal one, and we have tutors for the IELTS exam, and you are required to have a band of 7.5 if you have to work as a doctor. Meaning that if you score anything less than 7 in each domain, you will have to sit for that exam again. And I can tell you for free, the thing that scares or is a challenge for most Kenyan doctors is usually the writing part. So when you are preparing, ensure that you're polishing your writing skills. This is what is hard for many Kenyans, and not just even doctors. Even many graduates who, when you're doing their PR for Canada or for New Zealand, they really struggle with the writing part. So ensure it will be beneficial to pay somebody to polish up your writing skills. And it is good when you're practicing, you practice IELTS, writing, everything. The other exam is the OET. And the OET is like IELTS, but it is set up in a clinical setting. So it is testing your understanding of the English language in a doctor-patient kind of setup, and also in a colleague kind of setup in a hospital. And the GMC requires that you score a band of B in each domain for the OET. After you have finished your English certification, the next thing to look at is PLAB. You need to do your exams. So PLAB is an exam that has been there for so many years. Although they changed the name in 2023, they changed and they said that the effect was to take in 2024. But as I'm doing this video in 2025, no changes has been done as now. They were to change the name from PLAB to UKMLE. The name has not been changed. UKMLE, you can associate it with USMLE, yeah? But it has not been done yet. So the PLAB 1 exam is an easy exam. It is a theory exam, an MCQ. The fee as of now is £250. You will sit for the exam in Nairobi at the British Council. Although we have other testing centers. We have a testing center in Sudan, we have a testing center in Nigeria, Dubai, South Africa, and stuff, yeah? So you do the exam, it's a 3 hours MCQ exam. Simple exam. The answer is right before you. Actually, PLAB is easier than IELTS exam. And it's done 4 times in a year. So it's done after every 3 months. Booking of PLAB is not so difficult. You will book and you can even get a date 2 or 3 weeks or a month from the time that you book. It's not so congested. After you finish your PLAB 1 exam, you will sit you'll book for PLAB 2 exam. And PLAB 2 exam is a clinical exam. It is an exam where they test on your understanding of clinical situations. It's a doctor-patient kind of an exam. So it's done in Manchester, UK, and it's done every week. But the number of people sitting for that exam are so many because they're from all over the globe, mostly from Asia, from Africa. So you need to book early. As soon as you finish your PLAB 1, you book PLAB 2 exam. Right now, to be honest, you can even get a date of 1 year. Like you book in July, you want to sit an exam, and the next time you are getting a space is maybe June, July, or August of 2026. So you need not to delay so long after you pass your PLAB 1 exam. So it's £850, and there are many tutors for PLAB 2 exam. The most common is the Samson Academy. They do have online classes and they do have physical classes in Manchester. They charge £600 to £640 depending on how you're sitting for the exam. Yeah? So you need to prepare and to prepare well for that exam. And besides the cost of the actual exam, £50, you need to factor in the traveling cost and the accommodation cost in UK. And then after you have finished your PLAB exam, well done. You're done with the first 5 steps, which are the hardest. Yeah, those 5 steps are the hardest. The last 2 are easy. You go and you verify your academic documents with the organization called EPIC. So, one thing to avoid with EPIC is that you don't pay so early. You don't so early. And EDCAS is it's just like WES. You know the way WES verifies academic documents for African universities? for degrees holders from Africa. It's just like that. It's just that ETICAS is purely for doctors. And because it has a 1-year expiry period. So if you pay so early, and then it takes long before all these other PLAB and all these documents are done, you will pay again. Then after you have paid ETICAS to verify your documents as you're waiting for them to process, then you can go and get a certificate of good standing from the KMDC. So you need to be in good books with the regulatory body in our country. And after you're done with those 7 steps, good. Now you go to the GMC account, open a GMC account, register, login. When they give you the go-ahead, they communicate with emails. Mostly their emails are sent on Tuesday and Friday. If you get that communication, now you can look for a job, and there are so many job opportunities. There's so many job opportunities. You can get job opportunities when you're still in Kenya, or you can travel to UK if you so desire. So in terms of cost, because sometimes you talk with doctors and they are afraid of the cost, it's not so expensive. Especially if you did medicine as a private student here in Kenya or in Africa, you know the cost that Kenyan students are paying, about 600,000 per annum. It is still be cheaper than that. It's like an equivalent of 1-year tuition fee. If you've already, if you studied as a private student, that will not be a big deal because it's just 1 year extra. It's like the 7th year that you are investing to go and work in UK. If you are a government-sponsored student and you've already started working with the money that Kenyan doctors are running on their internship, you can use that comfortably as an investment for you to relocate to the UK. Yeah. So the IS, when you do the conversion, it will be around 40k to 38,500 roughly there. PLAB 1 is 250 pounds. PLAB 2 I told you is 850 pounds. ETCAS is 22,000. And then we have the GMC council registration, which is around 76,000. Total will be around 332,000. The only cost that is not added here is the cost of traveling to the UK, which you can put the flight at around 100k and the money for the accommodation. Yeah. So yeah, that is a process that you need to follow for you to work as a doctor in the UK. If you have any questions, do not find it difficult to reach out to us. We shall be glad to answer. If you found this video useful, consider subscribing, consider sharing with your friends. Until next time, bye bye.